Hi, so this is me, and for my service learning project, I did my volunteer time in the radiology department at Munson Healthcare Cadillac Hospital. I've been volunteering my time here since June for hours that actually go towards my graduation. That's occurring in about a week, actually. So I want to tell you about some of the things that I do in the department on a daily basis. I take x-rays for patients that come in with orders from their doctors, for patients that come in through the emergency room, and sometimes even for patients that have been admitted and been at the hospital for a while due to like having some kind of complication or surgery that required them to stay over. Not only do we do general x-rays of the bones and whatnot of the body, we assist the radiologist with other exams that involve using contrast. We use needles. We do pain injections for joints to help with pain or inject contrast in joints for patients that like eventually go to MRI or CT immediately after that appointment, and it gives them better diagnostic imaging. For other exams that we do are studies of the digestive system that start from like the mouth, it goes down into the esophagus, all the way to the stomach, and then sometimes we follow it into the small and the large intestines. These exams are scheduled ahead of time, so it has us so we call the patient to get an assessment and get health information and allergies ahead of time, so that way we have accurate information when they do come for the appointment. It goes pretty smooth if we do that ahead of time. There are a wide range of duties that I also do on downtime while I was there volunteering. We had to make sure that the rooms were, we do x-rays and exams, had all the necessary tools and necessary linens. Every room always has multiple sheets, pillows, pillowcases, cups, Emerson basins, in case patients feel like they're going to get sick or something like that, especially coming from the emergency room. There are towels and washcloths, multiple syringes, needles, tape, gloves, and other things that are stocked so when the time comes and we need it, it's available. Sometimes transporting patients back and forth from either their designated room in the emergency room or designated room for patients that are admitted is something that I would do as well. Many of the inpatients that are staying at the hospital are hooked up to IVs, catheters, heart monitors, things of that nature. Being cautious about making sure that the patients are comfortable is a huge part of also helping out. It's nice to see patients be so grateful for you being considerate of them with things that could be embarrassing for them as well. Another thing that patients appreciated very much was giving them a warm blanket that we provide. Many patients expressed how it was like heaven and made them feel so much better. Doing their x-rays hopefully hopefully help their doctor diagnose what's going on, but you don't really get to directly help the patients. So when you can make them feel better for a brief moment with a warm blanket, it makes you feel pretty good. So, how does my project relate to social science? I felt that my service learning project related to social science on a couple different levels. Viewing from the economical level, some people have access to insurance and some really don't, even though, they've made it to where we all have to be insured. We see some people who come into the emergency room for something that's truly been hurting them for a really long time, but they just don't have the insurance or the funds, and they know that the hospital can't turn them away due to the fact that they don't have those things. I did learn that hospitals allow a certain amount of money each year that they set aside for patients that can't, or won't pay for their medical care. Another one was anthropology. I felt it fit to my project because of the way that you have to act towards different patients. It depends on their background, their culture, their age. Depends on a lot of things. Certain things make you act differently toward them, more on their level, so that they feel comfortable with you helping them. What I took from my volunteer time was that you have to handle each and every patient differently. You build a small connection with them. Helping patients out, regardless of how small they act, it goes a long way. Going the extra step to help them feel comfortable in their state of helplessness shows them so much more comfort when you take the time to show interest in them and be empathetic. Whether it's getting someone that warm blanket or just simply reassuring them about their exam, it makes them feel better and feel like you care about their care. Not only did I take something from the patients, but also watched how some employees are good and bad. Made me realize what kind of coworker I do and don't want to be. That's all, guys. Thanks for watching.